Hello, everyone, and welcome to the latest edition of our Town Hall meeting. On behalf of the executive team and our board of directors, I want to thank you all for everything that you've done and continue to do during this pandemic. Hopefully, this will be the last town hall that we'll need to do virtually as the pandemic seems to be moving in the right direction. We are cautiously optimistic about the future, but we'll continue to be very careful as we are also entering the traditional cold and flu season this year and the unknown future of the pandemic. My comments today will be relatively brief, but there are a few things on which I'd like us to increase our focus, as my true north has always been to treat everyone's family members, friends, and members of our community the way that I would treat my own treasured loved ones. I ask that we all redouble our efforts in the areas of patient safety and teamwork, as well as patient experience. With every handoff, every shift change, and every huddle, we have the opportunity to take a fresh look at our work and review what we've completed or need to complete. That's a key patient safety moment to reflect and adjust when necessary. Check our meds, verify our rates, check dressings and lines, ensure that everything looks right, nothing has expired or exceeded the prescribed time. Patients have clean linens. We assist them if they are soiled and we haven't done so during our shift. Patients have received the right care, orders are completed, and we escalate questions and concerns to the applicable members of the medical staff in a timely manner. We should document patient behavior, but that should not be our only focus. We have to consider if we treated the patient with dignity and respect and whether we provided them with comprehensive collaborative care. Timely administration of care and treatment, appropriate documentation, and communication with the entire care team. That should be our focus. Fortunately, these are not new concepts, and they're very consistent with our stated mission, vision, and organizational goals. It appears that some of our challenges were brought on by the pandemic, but it's also relatively clear, looking at historical data, that we have had challenges in some of these areas for some time even before the pandemic. Of course, the pandemic has definitely not helped, but we have struggled with patient experience specifically for at least 2 years before the pandemic. Please keep that in mind with every interaction with all patients, families, visitors, not just the patients, families, and visitors that we know and to whom we can relate. Our biggest challenges seem to be with patients to whom we cannot relate. Fortunately, Press Ganey and UNC researchers are going to help us with this by identifying the places where this is most prevalent and where we have the greatest opportunity. We will also begin to ask patients in real time about their experiences and invite a wider group of patients to participate in our Patient Advisory Council. Thank you to Jacqueline and our foundation for helping us to develop a real-time notification QR code feedback loop for our patients, as well as our ongoing 125th anniversary celebration. Thanks to you all that are participating in this celebration and supporting this effort, and let's use this as a kickstart for renewal and improvement. Finally, if you see something or someone or something that's out of place, please say something. Talk to your leader or any leader in the hospital to ensure that we are aware and can address opportunities. As we continue to uncover some opportunities and improvements and opportunities to improve our compliance, the key point with this is to realize your blind spot. I'll just give you an example. If you see me with a stethoscope around my neck and it's not a Halloween costume, that would clearly look out of place because as you all know, I'm not a clinician. However, if you see an administrative teammate with whom you've worked for 20 years, your kids grew up together, you know them like the back of your hand, you know each other, you've been friends for years, you are far less likely to come to the same conclusion. You may rationalize that there may be a reason why they're wearing a stethoscope, although it's not true. We have to realize our blind spots to ensure patient safety and not allow ourselves to become a victim of someone that we have known or thought that we knew for decades. I'll end my comments as I began by asking that you focus on patient safety and teamwork, as well as patient experience like never before. Let's make each day better than the last and identify better ways to care for our patients and increase our coordination, collaboration, and communication. I will now be followed by Chanda, and she'll provide us with some very important updates.
Hi, everyone. I'm so glad to be here with you today. I'm Chanda Madar, the Director of Infection Control, and I'm going to talk to you today about how infection prevention And the measures that we use in infection prevention can impact patient safety and quality outcomes for our patients. I'm going to start with a short little story. Somebody asked me several years ago when I first started out in infection control if I could come up with one word to describe infection control. Now, infection control is a very big subject. So, but the one word that kept coming to my mind was cleanliness. So I looked up cleanliness, and lo and behold, it is, and one of the definitions is cleanliness is the first law of health. And I thought that was so telling for, healthcare in general. So hygiene basically is as old as the history of mankind, like the slide says. And, excuse me, there's one thought that I wanted to share about that. When I took a deeper dive into cleanliness, what it basically means is that all aspects of our health rely on cleanliness. That's talking about cleanliness of our body, cleanliness of our environment, and even cleanliness in our mind. I also found a very interesting article when I was doing my diving, and this was several years ago. I've kept it, called Cleanliness, the First Principle of Hygiene. This was written by Dr. Holtz in 1897. Now, I'm not mathematically inclined, so I did have to get the calculator out for that. So this was written more than, or about 124 years ago. That's a long time ago. I won't read the entire article, but there are some points that Dr. Holtz made that are still very relevant today. And that is the first line here, that hygiene is as old as the history of mankind. From the ancient Egyptians down to modern scientists. Now, when he says modern scientists, he's still talking about 1897, so that was modern to them. They recognized cleanliness as the first principle of health and believed in realizing it by endeavoring to secure pure air, pure water, and pure food for the people at large. Now, that still holds true today. You think for over 124 years, even longer than that, that same adage has held true. Now, we've come a long way in healthcare since that time. And although a lot has changed, the first law of health, or that cleanliness, has not changed. It remains a top priority for patient safety and patient safe care. There are so many people in our hospital that work daily to ensure that we have a clean environment and a safe and clean area for our patients to be taken care of. Some of those teammates we see every day, like the ones Dr. Tucker was talking about, with their stethoscopes around their neck, walking up and down the hall. Some of them we don't see every day. The people that make sure that our airflows are going correctly. The people that are making sure that our food is prepared correctly. Some of the people that work in the background we don't see every day, but we have people working diligently daily to make sure that our hospital is clean and safe for our patients. But no matter what your role is in healthcare or in this hospital environment, there are some very basic things that we can all do to ensure that we're providing a clean and safe environment for our patients. So this first slide that I want to go over is, of course, hand hygiene. And hand hygiene, and I have said this a million times, it is the #1 way to stop the spread of infection within the hospital environment. That is still true today. It's okay if you're going to ask, you can ask anyone in the hospital environment. You can ask Dr. Tucker. I would ask him if I saw him going into a patient room, and I would challenge you to do the same thing if he has cleaned his hands, and I would want you to do the same thing for me. Assess your own hand hygiene practices. Are you cleaning your hands like you should? Are you doing that hand hygiene before you go into the room, after you touch that patient? Before you go from a clean environment, from a dirty environment, to a clean environment. And that's not only in patient care, that's outside of patient care also. We don't want to be taking germs from a dirty space to a clean space. And when you're thinking about hand hygiene, teach by example. people will repeat what they see. Um, if we're consistent in our hand hygiene practices and we're doing that hand hygiene like we should, somebody's going to see that and say, hey, they're doing what they should do. So each moment that we practice hand hygiene is also that moment to teach correct hand hygiene to the person that is watching you. That person could be a student that is with you. That person could be the patient that is in the bed that is watching you when you come into the room. That person could be a visitor in our hallways. You are making an impact every time you do proper hand hygiene. You are making an impact. The one thing that I would like to say about hand hygiene is that when you think about it, about 100 times in a 12-hour shift is how many times you should be doing hand hygiene. If you are a clinician, you are a clinical person, you're at the bedside, how many times a shift do you think you're doing hand hygiene? If you are working in food service, if you are working in linen distribution, if you are working in any area where you are in a patient care area, how many times per your shift are you doing hand hygiene? Are you doing it when you should? Just make sure that you're thinking about that. Like I said, every time that you have a moment to practice is a moment to teach, and you're teaching somebody else how to do it correctly. Next slide, please. The next thing that I want to talk to you about is personal protective equipment and how we can use PPE to protect ourselves as well as protect our patient. Now, the picture in the graph here is of PPE that is worn by people at the bedside. Personal protective equipment is worn for everybody throughout the hospital and in some way or another. Whether you're outside working on the air conditioning unit, you've got on certain boots, you've got on a certain mask, you've got on certain gloves, or if you're working at the bedside where we're making sure you're wearing that eye protection, that N95 mask, or that healthcare provided mask, those gowns, those gloves, those shoe protectors for surgery. Any of those things are so vital to making sure that you are keeping yourself safe and not spreading germs from one person to another or from one area to another. We here at the hospital make sure that we have enough personal protective equipment to cover, excuse me, can we go back to that slide real quick? All aspects, thank you, all aspects of patient care, and anything that you need to take care of that patient, we have for you as far as personal protective equipment. Throughout the COVID pandemic, there have been supply chain shortages, supply chain issues. Our supply chain has done a fantastic job to make sure that we have maintained the PPE that we need to be able to take care of our patients safely. I cannot stress that enough. The other thing that I want to talk about personal protective equipment is our universal masking. I know as we kind of get out of our COVID way of life and we're trying to get back to some sort of normal outside of the hospital, while we're in the hospital, that universal masking really protects our patients and our teammates from one another to make sure that even if you are a carrier for COVID, that we're not spreading it within the hospital. We have patients in here that have all kinds of issues, and we want to make sure that anybody that has any kind of depressed immune system, that we're not bringing COVID to them or any other kind of respiratory issue, especially this time of the year with flu season. So make sure you're wearing your mask at all times while you're in the hospital environment. Next slide. Now this is kind of a special slide for me because I want to talk about cleaning and decluttering. Everything in our hospital environment is made to be aesthetically pleasing, from the outside of the hospital to the inside of the hospital. And when I talked about before in the article where it says that cleanliness the first principle in health is believed to be realizing securing pure air, pure water, and pure food for the people at large. So we want to make sure that we do that. But to do that, we have to have a pure environment. And we have to be out clean on the outside so that we can be clean on the inside. So when you drive up to the hospital, you know, our grounds are always well maintained, well kept. So you've got that outside that kind of brings you to the inside. You've got that well maintained landscape. So when you come into the hospital, you want to continue that well maintained area to take care of those patients. Whether you're in the halls, you want to declutter, you want to keep things out of the way, keep things in spaces where you need them. And once you get into those patient rooms, you want to make sure that you've decluttered that environment so that we can clean and keep spaces clean so that we can take care of the patients like we should. When you're in our environment, our hospital environment, I challenge each one of you to see the environment through the eyes of the patient and the visitor. When you're walking down the hall, it's very easy. It's just like when we're at home, we get used to seeing things in certain places. Try to imagine it from somebody that's not here every day. Are we putting things away? Are we being aesthetically pleasing? Are we making people feel comfortable in the environment that they're in? Is it clean? Is it decluttered? Are we doing everything to make that patient and that visitor feel comfortable? Because that is so important to providing that safe patient environment and getting those quality outcomes. And the last slide that I have is talking about communication, which is so important when we talk about patient safety and quality outcomes. If there's anything that we need to do, it's communicate about our patients, communicate about our environment, communicate about things that are going on in our hospital. If you're walking through your environment in the hospital and you see something that needs to be fixed or you see something, know how to put in that safe either that safe report or know how to put in that work order. Do you know how to do that so that that need is communicated properly? If you see somebody that is not doing their hand hygiene correctly, do you know how to communicate that to them in a way that is a positive reinforcement? This is how you should be, doing your hand hygiene, rubbing your hands together, giving that positive reinforcement, giving that feedback that we need to make sure that we're all doing things in a safe and quality manner. Make sure that you're communicating about your patient. Is there anything that you need to communicate to the next person that's going to be taking care of them? These are all so important when we're talking about patient safety and quality outcomes. I want to thank you for letting me talk with you today. If there are ever any questions about infection control and how infection control can help you to give better care to your patients, please give us a call here in our offices, and I look forward to hearing from you. Thank you.
Okay, thanks, Chanda. Appreciate that. We'll now have Dawn and Belinda talk to us about the very important topic of fall prevention.
Hi, everyone. This is Belinda Soflin. I'm the nursing director for the 6th and 7th floor. Don Norris is the director of nursing for the post-surgical unit, and we're the team leads for the fall prevention program here at Wayne UNC. We'd like to share some information with all of you so that we can work as a team to help improve our overall patient safety and prevention of falls. Next slide.
As you can see from this slide, even though this is an older slide from 2007 to 16, it comes from the CDC that shows our death fall rates in the United States. And this has increased by 30% during this time. Even though this is not specifically for older adults in the hospital, but it does show that the population is at high risk for falls, and they're also at risk for developing an injury with that fall. So if this rate continues, as shown in this graph, by 2030, we could anticipate that there will be 7 fall deaths every hour in the United States. Next slide, please. This graph here shows our inpatient falls here at Wayne. So it is from October of 2020 through September of 2021. And even though we see some improvement in our falls rate, as the number of falls has decreased a little bit over time, one fall is one too many. The more falls we have, obviously the more of a chance your patients have of developing an injury in the hospital, which could be very detrimental to that patient. Some of these injuries could be life-threatening, and we would never want our patients to be injured on our watch, right? So what can we do, or you do, as teammates here at Wayne to help keep our patients safe? Let us show you what we are already doing for some fall prevention strategies. Next slide.
So we know that here at Wayne UNC, most of our patients, majority of our patients, are over the age of 63. So the best thing that we can do is educate, educate, educate. On admission, we educate the patient with every shift, every day until the patient is discharged. We talk with the patients, we talk with the families to make sure that they understand that because they're in unfamiliar surroundings, they are at higher risk for a fall. It doesn't stop there. We also educate and help them understand how to help prevent falls even at home. Our clinical staff perform a fall prevention score every shift for our patients. This can range from patients being at no risk for to a very high risk for a fall. The score helps us to identify our high-risk patients throughout our organization. If a patient scores high, they'll have a yellow armband, a yellow slide in the holder outside of their room, and slipper socks placed on their feet. Bed alarms are engaged at all times for high-risk patients, and bed alarms engaged in the overnight hours on all patients. It's dark. They're in a strange environment. It's crucial that we use these alarms to notify staff when patients are getting out of the bed. Chair alarms are engaged at all times for high-risk patients that are sitting in a chair during the day or even in the evening. Intentional rounding. Intentional rounding is vital. It's such an important piece of the puzzle. All of our clinical staff really need to make sure that we are performing this to the best of our ability. Be proactive. When we make a round on the patients, we ask, do you need to get up to the bathroom? The last time I was in here, you didn't get up. How about we try to use the restroom? It's always important to ask those questions. About 70% of patients requesting putting their nurse call bell on is for restroom use. So always be safe, use appropriate equipment for your patient. Every teammate in the hospital that walks through the organization needs to be aware of their surroundings. Watch and look for patient safety opportunities. Make sure that we're responding. Everyone can respond to a patient light outside the room. If it's flashing, stop by and see if you can help within your job description. If you're unable to assist the patient, please notify someone that can help them. If you see something that you perceive as a patient safety risk, tell someone. Talk to their manager, your director, your supervisor, whoever you need to talk with so that the problem can be escalated and we can keep our patients safe.
Our number one priority is to keep our patients safe. That is one of our responsibilities of being here at the hospital and having our patients come to us for care. It takes a community, our family. It's our responsibility. Everyone that we have here is our family, and we need to treat them as such. We need to take great care of them. We also need to uphold that commitment to keep them safe. Like the picture on the slide says, it takes a village. One fall is one too many. We need to have a goal of 0 falls. Thank you so much for your time.
Okay. Thank you, Chanda, Dawn, and Belinda for covering the vitally important topics of cleanliness, hand hygiene, and fall prevention. Thank you to our environmental services, linen, engineering, and all of our clinical teammates that have vital roles in keeping our environment, to include our hands, air filters and water filters, clean. The key takeaway is, as was said, that a failure to do these things can actually prove fatal. And let's keep our loved ones in mind as we work on these very important aspects of our work, hand hygiene and fall prevention. I'm going to share my screen now as I'd like to end our town hall with a very powerful video. Some of you may have seen this before, but it remains a powerful reminder of the importance of our work. And of course, many of you have seen this before, and I've seen this countless times myself, but every time I watch it, I see something new. I think we can see our loved ones in that video. We can see our friends, our family members, our community in that loved one. Patients you may have experienced today in that video. And I think it's always important for us to remember that, we're all having challenges, and many of our patients are having the worst day of their lives. And you are the only ray of hope that they have. You're the only person that can give them any degree of hope that things may be okay. And so please keep that in mind as we work to raise our patient experience scores. We've been challenged with them for some time, but now's our opportunity to take hold of that and move it forward. So please continue to keep that in mind and focus on that as we go forward. Thank you for everything that you do, and please stay safe. Bye-bye.